Hi, I am Midwife Deidre, and I'm here today to answer a frequently asked question. What is it like to be a midwife? I'll first say that I've been a midwife for 5 years, and I've worked in two different states in the last 5 years. So, being a midwife is amazing. It is it is phenomenal. It is a job that is a lifestyle. It is taking care of women and families, and it is a very powerful position to have. You are being entrusted with the life of not just one person, but a lot of times two people. But I do feel like there are a lot of misconceptions about what a midwife does, and it's completely understandable. If you know what a midwife is, we always think about childbirth. A midwife is someone who delivers babies. Yes, we do deliver babies. However, being a midwife is more than that. It is supporting women in terms of women's health, in terms of their pregnancies, their entire pregnancies, not just the delivery. It is taking care of women while they are pregnant. It's taking care of women if they have health issues while they're pregnant. It is taking care of them and their families in the labor process, the delivery process, postpartum, and beyond. And that's what makes midwifery so amazing. It just encompasses so much. And now I'm speaking to midwifery from a certified nurse midwife perspective. So we take care of women from puberty through menopause. So there's a lot of women's health care that has nothing to do with pregnancy or labor and delivery. And that's the part that most people are just completely unfamiliar with. But I understand. So I'm here to explain what that means. So as a certified nurse midwife, if someone comes to me for birth control, if someone comes to me for any menstrual disorders, if they come to me for anything related to their health that is not a specialty, meaning that if they have a heart issue, of course, I'm going to refer them to a cardiologist, for example. Or if they have some other issues that is like outside of what I normally do, then of course we make referrals to other healthcare professionals. But as midwives, we can treat postpartum depression, we can treat menopausal symptoms, we can treat menstrual disorders. We can do so much in terms of women's health care. So I just want you to understand that if you are a prospective certified nurse midwife, please actually research the career and understand that it is not just delivering babies. It's not about holding babies and snuggling with babies, even though those are great things. That is not the majority of what we do. It is a big part of taking care of women, but in the grand scheme of their women's health, it is a very small part. And that's when it comes to understanding what the profession is and also knowing what different roles entail. Not every midwife job is created equal. There will be some places where you'll work where it may be mostly OB, meaning that you're taking care of women who are pregnant, and that is the majority, if not all, you do. There are some certified nurse midwife positions where your role may only be in an office setting, meaning that you're not really delivering babies, but you're taking care of women for their women's health, and you're taking care of women in their pregnancies and postpartum, but you're not involved in the actual delivery. Then there are midwife jobs where all you do are deliveries. You work in a hospital setting, or you work in a childbirth, a childbirth center setting only, right? You may work at a birth center that also has privileges at a hospital. So you may work at a health center. There are just so many places where you will find certified nurse midwives. So you really have to research where you live, where you want to live, to really see what midwives in that community, what they're doing. And that's not to say you can't do something else, but just kind of understanding like what positions are out there. Midwives are doing a lot. We are. So know that there are niches within midwifery. And as your life changes, your career can change, right? So for myself, I was a labor and delivery nurse prior to becoming a certified nurse midwife. And a few months ago, I decided that I wanted to step away from my position, and I took on a labor and delivery job again. So I'm a labor and delivery nurse right now. right? So that is what the profession allows me to do. It allows me to move however I want to move based on my life. And if I want to make a change, or if I need to make a change, I can do that. I can pivot in my career. I can say, okay, I'm ready to be a midwife again. I'm gonna go back in the hospital and deliver babies. Or I can say, you know what, I'm not really trying to deliver babies right now. I kind of need more of a office-based setting. Let me get a job doing that, and I'll just work in an office and take care of women just the same, except I won't be doing deliveries. And there are other midwives who may just do triage only. So they work for an institution where they triage patients coming into the OB, we call them an OBED, obstetrical emergency department. So it's not the traditional emergency department. It is, but it is an emergency department specifically for pregnancy. Usually these OBEDs only see pregnant women specifically for their pregnancy, or if they're in the emergency room for some reason they get cleared, but they just want to make sure that the baby's okay, they'll send them to the OBED, and they get evaluated by a provider there. So there are midwives who only do OBED. So they work in an emergency department setting, specifically for pregnancy. And they don't necessarily work in the office. They don't necessarily deliver them. They may, but that may not be their particular job. That may not be their particular role. So it's important to recognize that midwives do so many different things, and it's okay. It's not just one thing. It's not just one location. If you want to be a certified nurse midwife who works in a birth center, you can do that. If you want to be a certified nurse midwife who does home births or works in a hospital setting, delivers babies in the hospital, you can do those things based on your state guidelines. Your state, whether it's your board of nursing or your state board of medicine, every state is different. And I cannot speak to every state at all. So when you're exploring your career options and what you want to do, please think about flexibility. What types of flexibility do you see yourself wanting to have or needing to have? For some folks, it just is like, I want to be a nurse midwife. I'll do anything. But I do caution you to really think about your life. Just think about the lives of people that you know and how they've had to pivot their careers for various reasons. It could be a family member who may be sick or ill. It could be they may be sick or ill. It could be many things. They could be having a baby and they need to change, their career in some way to make space for whatever reason. So it's important to understand that being flexible in your career is imperative to your ability to stay within the fields. So please keep that in mind. You're no less of a certified nurse midwife because you decide to become a labor and delivery nurse again, or because you decide that you want to work in an office setting versus delivering babies in a hospital or birth center setting. It is okay to make those decisions. I became a certified nurse midwife because I wanted to take care of women. I wanted to be within women's health. That was my main goal. And I love the idea of being able to deliver babies. I did. But I understood that that was not the sole role of a certified nurse midwife, right? We do so much more. And that's what drew me in, okay? So I also did a dual program. I am a women's health nurse practitioner as well, and I am a certified nurse midwife. I did a dual program, and we were trained, the certified nurse midwives were trained along with the women's health NPs through the entire program up until we started doing the nurse midwives. We're going to do intrapartum, which is at the time when you were learning about how to take care of women in the hospital or in the birth center or at home when they are about to have their babies, the labor and delivery process. The women's health nurse practitioners, they stopped in the program right before we started our training in deliveries. Up until that entire point, we went to the same exact classes, the same amount of clinical hours as the women's health NPs. So that's why our program was considered a dual program, because we were receiving the same education as a WHMP to be a certified nurse midwife. And then our training extended a couple more semesters beyond the women's health NP program. So that's what made us a dual program and why I am a dual certified Nurse Midwife. So that means I'm certified through NCC, which is the National Certification Corporation. Oh, I said that wrong. That is my WHMP, and AMCB for the midwifery. So those are two different board certifications, and then I've maintained them both over the years. So I say all that to say you do not need to be a women's health NP to be a certified nurse midwife. However, if you're enrolled in or wanting to enroll into a program, it'll just give you both certifications. I'll discuss in another video of how that can be useful, specifically to be a women's health NP and a certified nurse midwife. But I will just say, for those who want to be a certified nurse midwife, you do not need to be a WHMP. I'll just say that off the bat. I particularly did that for a reason, and I'll explain that in another video. So that is my explanation about why I became a certified nurse midwife. I loved women's health. I love taking care of patients, but I really want to take care of women. And I wanted the opportunity to influence the health of families. I really do believe that if you take care of a woman, you're taking care of her entire family. As women are generally those in the household who are taking care of little ones and their partners, other family members. And if you have an unwell, sick woman, then you have an unwell, sick family. So that is why I want to become a certified nurse midwife. So this is Midwife Deidre. Thank you.